Okay, so I would like you to, for me please, explain what you do in Beck's cognitive therapy. So if somebody has come in to get therapy for you, some CBT, what do you do?
So the first thing you do is do an initial assessment, and in that you want to gather what the trigger was of them feeling unwell, and then you'd want to have a look at what thoughts they were having, how they felt emotionally, and emotions are normally one-word answers, so things like sad or happy. If it's more than one word, then it's normally not an emotion.
Okay.
Then you want to gather what they're doing, so their behaviours. And then you want to gather how they're feeling physically, so like tired or things like that.
Do you put their emotions into the negative triad?
You can do that, yeah, that can be a really helpful way. But if someone can't think very psychologically minded, then you wouldn't do that because it might confuse them.
Okay, so you would put them into the negative triad, but maybe not in the assessment.
Not in the assessment.
Okay.
And in the assessment, if they've got depression, one of the most important things is to ask about risk, so suicidality, if they've self-harmed or if they have any plans or made any preparations to hurt themselves,
Right.
especially in depression, because one of the main thoughts is feeling hopeless. So what you want to try and identify with them in the initial assessment is these main things, because there's a big crossover, so they can all link to each other and create what we call a vicious circle, whereby you can be stuck in this cycle and one thing can lead to another. So if you're having thoughts that life is not worth living, then you might segregate yourself from your friends and not go out and not be sociable. So after you've done the initial assessment, then you do a formulation. And Beck has a special formulation that you would follow. So either a longitudinal formulation, which looks at what happened in your childhood and the precipitating factors, and also like key events that might not be the initial trigger, but it might be something before the trigger that then makes the trigger much more upsetting for you.
Right. I thought that CBT didn't look at the past.
It doesn't, but you need it in the formulation to understand why this is so effective.
Okay, so it doesn't treat the past.
Doesn't treat the past, but if someone's having a thought, that might be linked to what happened in the past. So that's why you need to understand the past to be able to focus on the here and now, because CBT is all about the here and now and in the present. So after you've done a formulation, that's your plan, and that informs your treatment protocol.
Okay.
And your treatment protocol would mainly focus on these two areas, so the behaviours and the thoughts, because we know that if we can change this area or this area, then it can help to break that vicious cycle and almost be like an exit off the roundabout.
Right, okay.
So it doesn't lead to feeling sad, or it won't lead to feeling very tired, those types of things. So what we do is we do cognitive restructuring, or as CBT therapists call it, CR. Or you might do behavioural activation, or BA. Or another thing that you might do here is a behavioural experiment to try and change the thoughts that you're having. So a BE. And what that does when you're doing each of these interventions, you'd give the person homework. So for cognitive restructuring, it might be something like a thought diary. For behavioural activation, you might ask them to keep an activity diary, which focuses on 3 things. So pleasurable activities, necessary activities, and routine activities.
So behaviour activation is all about trying to get the patient to do things that they would find enjoyable.
So it's trying to get them to act opposite to how they're feeling.
Okay.
So they might be feeling really low and sad, and then that means that they don't want to go out, and then they don't see their friends, so that gets reinforced.
Okay.
But if you're acting opposite, then you're getting reinforcement that you're having a good time.
Right.
So that can help to break that cycle. So behaviour activation doesn't normally work within the first week because it's really hard to get that motivation, but it works on the process that you do it over a number of weeks and build it up, so that then you get that positive reinforcement. And then at the end of treatment, what you'd normally do is you'd normally have some questionnaires that you've done at the beginning, some questionnaires that you've done at the end, and then hopefully you'd see a change in the scores measuring symptoms of depression or anxiety.
Yeah.
And they would drop, and that's when you know that you've finished a good treatment and that you've come to the end. And then you'd send them away with a relapse prevention plan. So thinking about their warning signals. So green is when they're feeling good, what they'd normally do. So maybe walking the dog or seeing their friends.
Yeah.
Amber is small things that they might notice. So it might take them 20 minutes longer to get out of bed in the morning when they're not on green, but they're not quite at red when it's the worst that they've ever felt.
Right, okay.
So amber is the main thing that you want to look at, because normally people are quite good at being able to identify these two things, but it's that transition period between the two, which is where the therapist needs to do work to help them prevent from going back to red.
Yeah.
So you want to try and kind of alternate between these two, because it's very likely that you will, you know, go from feeling good to not so good, but you want to prevent those not so good days from turning into weeks and months and just have them for a few days.
Yeah.
So that's another really important piece of work that a cognitive behavioural therapist would do at the end.
Amazing. So with just one more thing with the homework. So you said that you set kind of like a thought diary. Does the homework help kind of in the future if the patient does relapse? Can you present them with the homework again?
Yeah. So they might have come with a thought that I'm worthless or I'm stupid or something. And with your thought diary, you will have taken the thought to court and looked at evidence to go for and evidence to go against that thought. So then they've always got that to look at, and they can, you know, if they're feeling that that thought is really important for them, they can look at the evidence that you've gathered for and against and use that to help them.
So it's like proving basically that they're wrong.
Yeah, pretty much.
Okay, amazing. Thank you so much, Bex.
That's all right.
Thanks.
Bye-bye.